How can blood sugar testing be useful for helping people to improve conditions such as prediabetes and type 2 diabetes? So blood sugar testing or blood glucose testing is a method to tell you at any given moment how much sugar or how much glucose is in your blood. And the reason this can be useful when we're trying to improve our health is because we can get rapid feedback on what we are doing. So it can be sometimes quite hard to know what foods are going to be helpful for our health, what food's going to help improve prediabetes or type 2 diabetes. We might think we know, we might have read a list, or we might have read something online, or somebody might have given us some advice, and we might think it's good, for example, to eat porridge for breakfast because that's healthy, so we think. Well, what blood glucose testing can do, you can get a feedback on what a particular food does to you. And the method of doing this is something called paired testing. So you check your blood glucose level, often with a finger prick blood sample, before you eat anything. You then eat the food, and then 1.5 to 2 hours later, you recheck your blood sugar level. And if that blood sugar level is still high, then you know that actually whatever you ate is not ideal for your health and for your biology and how your body's working. Whereas if your blood sugar level is normal, then you know actually whatever you ate, the body's handled it well and it's maintained, it's come back to a state of happiness within 1.5 to 2 hours, which is a good sign. Also, you can do more frequent testing. So you could test 20-30 minutes after eating something. If you're trying to avoid any food that raises your blood sugar, you might want to catch it in that 20 to 30 minute thing, just in case it shoots up and then comes back down again rapidly. So blood glucose testing can really help guide your personalized dietary choices. So you can forget having to rely on what anybody else tells you, whether it's me as a doctor, whether it's something you read online. You can actually use blood glucose testing to see what actually happened to you. Now, other than pricking your finger, there's a number of new devices now available to people. Usually these are things we have to buy ourselves and not available on prescription from a doctor. However, these are very useful. They're called continuous glucose monitors, and they are in effect patches with tiny little filaments or needles that go into the skin, and they constantly measure the amount of sugar just outside your blood vessels, which gives a rough indicator of how much sugar is actually in your blood at any given moment. And the benefit of these is you can slap them on and they will last anywhere between 1 and 2 weeks and give a continuous readout of what your blood sugar level is doing. So the benefit of these is if you keep a really good food diary and you're wearing one of these, you've got really good quality data over a week or two of what's going on with your diet, what's going on with your blood sugar level. From a point of view of a doctor, I find that data extremely useful. If somebody isn't achieving the goals they want to achieve, having a really good diary of what they've been eating, plus a really good readout of what the blood sugar's been doing, we can usually really quickly identify where the problem areas are if they're not achieving their goals, and therefore what adaptations they should make to their diet. Another way I find it useful as a doctor is if somebody has significantly improved their health, but they did that through going on a very low carbohydrate intake, and they're now wanting to relax that a bit, they might ask me, well, how much carbohydrate can I eat? Well, by using blood glucose testing, they can answer their question themselves. So they can increase their carbohydrate intake and then see what that does to their blood sugar without having to wait 3 months for the blood test, the HbA1c blood test, to see what happened. So I find them really useful with patients from that point of view. So generally speaking, I would often recommend or suggest that patients do use some form of blood glucose testing because their feedback can be helpful. However, for many people, and certainly people with prediabetes and most with type 2 diabetes, they would have to buy these themselves because they can't be prescribed on the NHS. But it could be a valuable investment, even if just for a couple of weeks.